Residents gathered at Mitchell College in New London to air concerns over the proposed takeover of Lawrence and Memorial Hospital and its health network by Yale-New Haven Health Systems.
A group of us, a coalition, came together, comprised of faith leaders, community members, public policy individuals, healthcare providers, and labor organizations who are committed to ensuring that our communities have quality, affordable healthcare that serves all people in this region.
All of the major national measures of quality in this field are, while difficult to interpret and sometimes conflicting, pretty uniform. That it's the locally owned community hospital of medium size that comes out on top.
Despite a local L+M-based board of directors, every facet of patient care will be controlled by Yale, period. People need to know that that's very important, that their healthcare decisions are going to be made by someone in New Haven and not New London.
Over the past 5 years, L+M Hospital has been subsidizing other parts of the L+M Corporation to the tune of $82.2 million. If they had not transferred that money out, L+M would be in great financial shape.
And hospitals like L+M may think that their only salvation is to allow themselves to be taken over by huge hospital systems. But I'm speaking as a doctor that the cure here may be worse than the disease.
The hospital also brought the Hospital of St. Raphael, which is down the street and around the corner from Yale-New Haven Hospital. Those workers who work at St. Raphael's Hospital had to reapply for their positions.
Right now, the most important piece of this meeting is we're going to be hearing from you. We want to hear what you believe should be in this community in terms of health care.
Our table talked about access to community services, the ICU, the CCU, the Cancer Center, emergency care, women's health issues, early ectopic pregnancies, mammograms, all of that is done locally.
We saw the images of the lanes, as I said, and the garnishing, and almost all of us had a story about how when we couldn't pay a bill at L+M, we could walk there and talk to a person.
I think everybody that sits in this room and every patient and every person in the community wants to know, is the quality of care going to be impacted by a lack and reduction of the workforce?
Our table had a discussion about concern about the bottom line mentality in our capitalist society, just the race to the bottom.
We have a lot of low-income families that struggle just to get to Pequot Medical Center and L+M as it is.
What we saw happen in Willimantic with Hartford Hospital and Wyndham Hospital, it seems like it's a David and Goliath war, whereas with Wyndham and Hartford it was Goliath that won, and here we want David to win.
And that's the thing I love, whether it's the patient, whether it's the worker, whether it's the person that live in the city, right? Basically, humanity is the thing that we're fighting for, the beloved community.
Add your voice to the discussion and be part of making sure that Southeastern Connecticut won't pay higher prices or lose access to quality acute care services. And put patients before profits.